It's another weekend, and we are here with the Weekend Health Talk. I am your host, Dr. Albert Sedo here. This afternoon, this evening, I have an amazing specialist, senior specialist, going to share with us on the topic infertility in both men and women. And the beautiful thing is, he has the experience that is needed to have this thing well covered. All right. But before I introduce him, I want to remind you why I choose to be doing this on weekly basis. And it's weekly, every week. I do it every Saturday, God willing. I do this. I host several specialists, topical issues. I want you to hear from the experts themselves, not just from hearsay. All right. These are some of the reasons why I do this. There is lack of adequate health education in our schools these days. There's so much lies and misinformation out there, especially on social media, from especially people who are not qualified to give you such information. And we all know prevention is better than cure. So if you know about what the condition is and how to prevent it, it's best, all right, in ourselves, in our parents, in our friends. And there is very short contact time when you go to hospitals these days. So you have a free opportunity, free platform to ask your questions and get direct expert knowledge. And of course, a lot of people want shortcut to everything. There are conditions that may not be curable, but you can manage it and live healthy, normal, optimal life. So you need good information to do that. Another side to this is it's on my YouTube channel. I've shared it in the chat box. It's on my YouTube channel. Just subscribe to the channel, put on a notification, go back there to listen over and over and share with your friends. And on the YouTube channel, you feel free to ask your questions in a chat box, and we will respond to every question that you might ask. We have a few minutes to present this. After that, we'll open a chat for about 10 to 15 minutes for questions. So you feel free, any question you have, you can ask when the presenter is done. Now to the meat of today's presentation. Thank you all very much. We have about 200 people on Zoom and a lot more people, close to 20 people on YouTube live watching us. Thank you all very much for making time. Now, this afternoon, this evening, wherever, or this morning, based on when you are watching this, I have an amazing senior colleague. He is a senior ops gynecologist specialist. He's had over a decade experience in this field. And today, we are honored to have him to share with us on the important topic, infertility in both men and women. Please kindly help me welcome Dr. David Wilfred Parker Alote, Senior. Over to you, sir.
All right, thank you very much, Dr. Albert Sedo here. I hope you can all see my screen. If you can just see my screen, just type Y in the chat box. If you can see my screen and hear me clearly, just type a Y in the chat box, and then I know you can all see it. All right, thank you. Thank you very much. Thank you very much. And thank you, Dr. Albert, for hosting this call, for us to share this important knowledge that people need to know. All right, as a gynecologist and in any gynecological consulting room, majority of people who come for consultation come with infertility. In every gynecological room, over half the people who come for consultation come with a problem of infertility. The problem is that most people come when it's late. All right, they've gone to so many places, gone to the herbalist, gone to church. Most people don't have any idea about what may be causing this, And there are so many myths about infertility that is going out there, and then we'll talk about some of them. All right, so these are some myths about infertility, and as I share them, I'm sure most of you would have heard them. There are some of you who will probably be believing some of them already, and then at the end of the lesson, we'll find out if those myths, if we can answer a lot of this. So myth number one: infertility is almost always caused by problems with the female. That's myth number one. So of course, every time a couple is married, there's no pregnancy, the whole society, the families, everybody straight away blames the female. So most of the time you see So always a woman who is coming to the clinic to seek for help, and it's not always true. We would find out at the end of the time if it's true. Now, two, infertility is a spiritual problem that requires spiritual solution. All right, is this also a myth? Because in our society, there are we assign a lot of things to culture, spirituality, and there are a lot of tribes that do a lot of things when especially a person, a man or a woman dies who did not have a child. They do a lot of some cultural practice that in the afterlife they believe it be fertile. So is it a spiritual problem? A lot of people go to the church prayer houses, prayer camps all over before they end up with a doctor. Myth number three, if couples would just relax, they would conceive right away, no need seeking care. All right. Number four, cardinal symptom of infertility is sperms coming out of the vagina after sexual act. Now, any lady here who I'm sure has complained about that before, especially if they are trying to get pregnant, they always wonder, why is the sperms coming out after sex? So they believe that is the reason why they are not getting pregnant. We'll see if this is true or not. And then five, infertility can be done to improve, can be done to improve a man's sperm count. All right, now a lot of the time when couples are infertile, we do the semen analysis, check the man's sperm. That so many times you see that the sperm count are very low, and I'll show you some. All right, and so what do? Most people believe that nothing can be done. So far as a man's sperm count is low, that is it. There's no way he can get a woman pregnant. Number six, a man's fertility doesn't change with age. Seven, infertility means you can't have a child. So when you are pronounced infertile by a doctor, does it mean that's it? Does it mean you can never ever have a child? Is there a solution? We'll find out. Number eight, smoking marijuana doesn't affect fertility. Nine, eating habits and weight have no bearing on fertility. Is it true? How does your weight affect your fertility? Is it good to be obese or overweight, and you think it doesn't have anything to do with your fertility? And number 10, family planning causes infertility. This is a big issue that women are always asking me about. So we'll find out if these are true at the end of the lesson. So what is infertility? We should remember, infertility is a big problem, all right? It is a complex health challenge, and it comes with a lot of psychological stress for the couple. So much stress, so much frustration, so much anger, and it leads to so many things in the marriages. So it's a very important topic that we can't take for granted. And globally, it's a major health issue, not just in Ghana, in the whole world. It's a big, big, big challenge in the whole world. And most health insurances worldwide do not pay for the treatment of infertility, all right? Even though it's global, it's a big problem. And then the social consequences of infertility are not easy, especially in Africa. And it affects women more than men, because any couple who doesn't have a child, the woman is always blamed. People talk behind the woman in her neighborhood, where she's staying. They say all sorts of things about her, all right? So it's a big problem in Africa, where when you marry, within a few months, your mother-in-law is asking you, hey, when is the grandchild coming? When am I getting my grandchild, all right? And partners become more anxious with increasing sexual dysfunction, all right? With all the frustration that is happening, you realize that it even affects the couple, it even affects their sex life. They can't even have sex. The man, most of them may not even have an erection, not because he has a problem with having an erection, just the stress and all the pressure on him affecting that man. So this is how impactful it is. And marital discord often develops in infertile couples, all right, especially when they're under pressure, all right? And a lot of divorces happen because of this, and once it gets to a point when one partner may cheat on the other just to prove that he has no fertility issues, he can produce a child, all right? And of course, we would end up having unprotected sex outside the marriage, and we bring diseases into the marriage. So that's very important. Globally, this problem affects about 15% of couples, all right? And women trying to conceive have clinical depression rates similar to women who have heart disease or cancer. That is how bad it is. So you can imagine the depression that a woman with a heart disease goes through, or cancer. If they pronounce you of having a cancer, it's going to kill you. The depression that a woman goes through is the same kind of depression that a woman who is battling infertility goes through. So this is not something we can take for granted at all. And it shows here in a news article on the Ghana Web, March 2019, a couple poisoned themselves after 10 years of barrenness, all right? And there's so many news articles like this and a lot of things that happen for this time. So what are the consequences of infertility? All right, just not having a child. Frustration. Frustration is a big problem, all right? And it can make you do so much that you don't want to do. I mean, out of frustration, Sarah told Abraham to go and sleep with Hagar, their maid. And you saw how it changed the course of history and all the problems it brings. So it's not an easy thing at all right? And of course, depression is also a big issue that comes. And as I've said about it, they are vulnerable, especially the women. You know, just the fact that they're not getting pregnant makes them vulnerable to a lot of quack doctors, fake doctors, herbalists, pastors. You know, people go to prayer camp, pastors take advantage of the women and sleeping with them. You know, that is how vulnerable they become. Of course, family stigma is also very, very important. You know, those days when in our society, when a couple is going to get married, the other family sends people to go and check their family history, whether they are fertile, they produce children. That is how important it is. So whenever there's infertility in a family, the whole family is stigmatized, and that is really bad, all right? And of course, testing fertility outside their spouse. And we get that often. You know, a man believes that there's nothing wrong with him, or a woman believes there's nothing wrong with her. And so she goes to have sex outside just to show that, yes, she's fertile. Of course, it always leads to divorce and unstable home and manipulation by spiritualists, herbalists, self-acclaimed prophets, and all that. So these are all some of the consequences. So that was a brief introduction. So what is infertility? Now, infertility is inability of a couple to achieve pregnancy over an average period of 1 year, all right, with regular sexual intercourse. When we say regular sexual intercourse, it has to be at least 3 times a week, all right? So listen, the definition as well, a year. So a couple should have been trying for a year, having sex regularly, at least 3 times a week, all right, and then not getting pregnant. If the woman is above 35 years, we don't use the definition of 1 year. We use the definition of 6 months, because when a lady gets to 35 years, it's a critical point in her life. Her fertility declines immediately, all right? She's not as fertile as she was when she's younger. A woman is most fertile in her 20s, all right? Mid-20s, 24, that's where a woman is most fertile. At 24, 35, her fertility decreases. So when a woman, you are a woman, you are getting close to 35, and you are still having problems getting pregnant, you still do not relax. You have to seek help immediately, because things get difficult after that, all right? And so sometimes you get couples, they are staying apart, one is staying in Sunyani, one is staying in Hu, they are barely having sex. Once a month, twice a month, 3 times in a whole month, and they are complaining they are not getting pregnant, all right? They are not having enough sex. Okay, so that's the definition. No, why do we use 1 year? Because it is important to know that most couples who there's nothing wrong with them, all right, the man is very okay, the woman is very okay, at least with regular sex, it will take about 57% of them to be pregnant in 3 months, 72% to be pregnant in 6 months, all right, 85% to be pregnant in 12 months. So the fact that you're not getting pregnant within your first 3 months of marriage or trying to get pregnant does not mean you're infertile, because as you can see, studies have shown that it will take only 57% of women will get pregnant within the first 3 months, all right? So that is why we wait for that length of time, at least 1 year before we investigate if there's nothing happening, all right? So when you marry within the first 1 month, 2 months, you shouldn't get worried. I've had couples, as soon as they get married, then they are coming, doctor, we are not getting pregnant. Of course, it is different if you were having regular sex before you got married. That one is different. That one you already be having sex already, but this is a study done mainly among married people. Now we have 2 types of infertility. We have what we call primary infertility. That is infertility mostly in a couple or a woman who has never gotten pregnant before, all right? She's never ever gotten pregnant before at all. A secondary infertility is a woman who probably has gotten pregnant before and now she can't get pregnant. So you ask her, well, how old is your last child? Her last child, she maybe had a child when she was in a teenage year or 10 years ago, the previous marriage, or maybe the same marriage, but it's been several years and they've been trying for a long time and they're not getting pregnant. Now that is what we call secondary infertility. Now, this slide is very, very important. Look at the statistics. What are the causes of infertility? Now you can see that the male factor and the female factor are equal. 30% could be due to the male, 30% could be due to the female. So now what tells you about the myth, one of the myths that I read, that infertility is almost always caused by the female. That is wrong, totally wrong, all right? The male can be as much responsible for the infertility as the woman. So it is unfortunate that in our society, whenever a couple is not getting pregnant, it is always the woman who is coming to the hospital. And the whole society is blaming the woman. That is what, due to what? Lack of education. So if you're a woman and you're listening to this on this call, know this, it is not always a woman's problem. And funny enough, sometimes, most of the time, it is fellow women who even blame other women more, mother-in-laws and all that. Combined factors are 10%. And sometimes we just can't find the cause of the infertility, all right? Now let's talk briefly about the male factor, and then we'll talk about the female factor and what we can do, all right? So you all know this is the male sex organ, and then the sperms are produced in the testis, all right? That's where the sperms are produced. And when he has sex, the sperms have to be released into the female vagina, where they have to swim a great distance with a lot of hindrances on the way to get to the egg. It's not an easy swim at all. And that is why a man has to produce a lot of sperms, all right? About at least more than 20 million sperms per male. That means a male has to have 20 million. That's a lot. In fact, initially it was 40 million. These days they've reduced it to 30 million, 20 million. And in fact, studies have shown that men are producing less sperms in life these days. And we'll get to know some of the reasons why, all right? Just last week, I had a man who did semen analysis, and it was 40 million. I've never seen that in a long time. In a long time, I don't see 40 million. You know, and that shows that these days men are not producing enough sperms. So this is the sperm, how the sperm looks like. And it's very important that the sperm should be normal. Okay, apart from the fact that the sperm should be able to swim very well, sometimes the sperms can be abnormal, all right? Look at this sperm, it has two heads. This is a very abnormal sperm. Look at this sperm, it has two tails, all right? This one has what? The body is not normal. It has a smaller head and longer neck, all right? Sometimes they are not able to swim well. So the sperm have to be normal as well. So apart from the fact that they have to be plenty, they have to be, a lot of them to have to be normal, and a lot of them have to be able to swim in a forward direction, not sideways or backward direction, all right? So that is very, very important. Beautiful, beautiful. All right, let me go on. All right, so what are some of the abnormalities that can happen in semen? So low sperm count, all right, and that is very, very important. A lot of men have very low sperm count, and they always blaming the woman. Oh, you are not getting pregnant, you are not getting pregnant, you are not getting pregnant. It can be low. The sperm can have poor motility. That means they are not moving well, all right? They are there, but they can't move. And it's not the great distance and swimming that they have to do. So obviously, if the sperms are not moving well, they are not going to be able to do that, all right? Abnormal structure. Some don't have tail. I showed you all that and all those things. You saw it. Absence, this thing. And other challenges are men have erectile dysfunction, so they can't even have an erection enough to be able to deposit the sperm within the woman. At last week, we had there was a call on erectile dysfunction, which is on the YouTube link. You can watch it, all right? So they can't have an erection. And some men cannot ejaculate, all right? They can't ejaculate at all. They have sex, they don't ejaculate. So this is an example of a sperm count. This was something I did for somebody just 3 days ago. And you can see all the parameters we look out for, all right? And what I want you to see is look at the sperm concentration. It's 12.7 million. 12.7 million look like very huge, but in this case, it is very, very little. It is not enough to make a woman pregnant. Of course, this is from somebody who have been married for a long time, they are not getting pregnant, all right? And so you can see a typical example, 12.7 million. So we say it's what? Oligospermia, all right? And this is another one, all right? That was done, you can see just 28 August. And you can see this sperm count is even low. This is what, 1.5 million, just 1.5. I told you I had a man who had 40 million, all right? So this man is definitely not going to be able to impregnate the woman normally. Something has to be done to get this to increase. And apart from that, you can see that the motility too is not good, all right? And assuming a lot of the other parameters are also not good, all right? So that's it. So what are some of the causes of male factor infertility? Things that mainly affect the sperm, all right? Heat, stress. A lot of men are going through stress. Stress is not good for anybody. Heat, those days when, that's why the testis is outside the body. The testis, God didn't put the testis inside the body. He put the testis outside the body because that factory where the sperms are manufactured doesn't need heat. That's why it's outside the body. So men, don't wear tight panties, all right? Don't wear silk panties and nylon things, all right? Wear something, loose boxers. Let the testis swing around the way it's supposed to swing. Air should pass around it. Otherwise, it gives a problem. Varicocele, that means some people have an abnormalities where there are a lot of blood vessels in the testis, all right? So it brings a lot of heat there. You know, blood brings heat. So it affects the factory, all right? Because the man hasn't come to hospital, he doesn't know this, and he keeps on blaming the woman, but he has varicocele. Poor diet, all right? What you put in your body affects the factory. Where the sperms are produced, we call it spermatogenesis. It's a factory, a serious 24-hour working factory. And for every factory, you have to provide it with raw materials to be able to work well, all right? High BMI, that means weight, obesity. Men who are obese, who are overweight, they have problem with spermatogenesis and even having sex and all that, all right? So weight, obesity is very, it affects your fertility, as you saw in one of the myths, even for men, not just for women. Alcohol, smoking, all right? Sometimes somebody wants to get pregnant, it's always smoking, it's always drinking. This has a direct effect on sperm production. Now, groin surgery, men who have had surgeries around their testes, around their groin before, sometimes maybe there was an anomaly, maybe something that shouldn't be cut was cut, and then it also causes, so those sperms will be able to come out, all right? And chronic illnesses, a lot of the chronic illnesses definitely affect the factory because the factory is sick, all right? So things won't work well. All right, now that's the male. Now let's talk about the female. Now it's important. And I always tell couples who are coming for fertility, normally when people come and see me with issues of infertility, I always like to handle the man first because the man does only one test, that is semen analysis. Just go and masturbate and then get the sperm and then we look at it. So that is the only test that a man has to do, nothing else. But the woman has to do a lot of tests. And some of them are invasive. That means you put things inside her body, all right? So the woman has to go through a lot. And the woman, her cycle to also has an effect on when the tests are done. So sometimes you have to wait for the menses to come before she can go and do that. So it prolongs and drags them. So sometimes the woman will come alone, she'll waste time, do all these things, and some will be expensive, nothing will be found. And then when you bring the man, finally, he comes in, he has no sperm count. And he wasted all this money and the time when the man had to do a simple thing, all right? So for the woman, it's a bit more complicated and complex, and then we'll discuss it. So all these things, problem with any of these structures that you see here can cause infertility in a woman, all right? So these are the eggs. If the eggs, these are the ovaries produce the eggs. So if the ovaries are not producing eggs, there'll be no eggs to fertilize, so infertility, all right? So that time that women have problems with the ovary, they have certain diseases that does not make the ovaries produce eggs, like polycystic ovarian syndrome, which is a very common one. I'll talk about it later at the end. So they are not producing eggs, all right? And most women who are obese have a lot of hormonal imbalance, all right? A lot of the overweight and obese women have a lot of hormonal imbalance. So if you are trying to get pregnant and you're not getting pregnant, you're overweight, know that just losing weight may help you a lot, right? Sometimes the tube can be blocked. Now you saw all the sperms that were moving. This is where the sperm will meet the egg. They will meet the egg in the tube. They don't meet the egg in the womb. No. They swim past the vagina. This is the womb. I hope you can see my cursor. And they enter the tube, and then they meet the egg here. So if the tube is blocked, there's no way the sperm and the egg can meet. And so there's no way any person, a woman whose tubes are blocked, can get pregnant naturally. It is impossible. The only way such a woman can get pregnant is by something we call in vitro fertilization or assisted reproductive technology. All right, so sometimes this is the issue. And for 10 years, this couple are going to see all sorts of things, prayer camps, going all the way, and their tube is blocked, and they are wasting the time all. And so by the time the woman finally comes to a gynecology, she's 40 years, her ovaries have very few eggs in them. The egg has so diminished. Now let me tell you, the eggs, every ovary has so many eggs in them. The eggs that you have in them started when you were about 12 weeks in your mother's womb, all right? That is when all your eggs were deposited in your ovary. Now those eggs do not increase in size. The numbers do not increase, all right? Every month you release some as ovulation. So by the time you're 45, or 35, you've released a lot of them. So remember when you were young, 12 weeks in your mother's womb, and then you're 35, all right? Unlike men who they are always producing sperms, all right? So coming late is very bad. Of course, the womb, the uterus, we can have a lot of problems with it, like fibroids. Sometimes women have fibroids. The fibroids may be sitting at a place where they have blocked the tubes. So the eggs can enter, the sperms can enter the tubes, all right? Or they are sitting somewhere in the middle where even if there's fertilization, the embryo or the fetus will come and lie. So there's repeated miscarriages and all that. Sometimes the whole womb is abnormal. Okay, some abnormal. They have some congenital anomaly. So it doesn't work. All right. So these are all the things that can cause, as I said, the ovary can have a problem, the tube can have a problem, the womb itself can have a problem as well. All right. So these are all some of the causes of female infertility. So the problems, the thing that causes the ovaries not to release egg every month, because if you're not releasing egg, you can't get pregnant, impossible. Polycystic ovaries, hormonal problems, as I said, mostly because of obesity. That's the main thing, or overweight, all right? Drug use. Problems with the tubes, all right? As I said, the tubes can be blocked, and so many things can cause blockage. Infection. Normally, women always have vaginal infection. They keep, oh, doctor, they'll call a doctor on the phone. Doctor, I have white. Can you send me a medicine? Or they'll go to a pharmacy. Please, I have vaginal discharge. The pharmacist will just give any medicine without knowing exactly what is causing the problem and how exactly to treat it. So now most of these vaginal infections that women have and they don't treat well, it could be chlamydia, it could be trichomoniasis, it could be gonorrhea. All these things causes the tube to block. So you were playing with these things in your younger age, and now you're 27, you're 30, the tubes are blocked, you can't get pregnant because you are not treating the vaginal infections well. You're just going to a pharmacy, or you were saying it's white, or you were telling a friend told you, oh, last time I had a doctor give me this, so you take it. Please, if you have vaginal infection, go be tested by a gynecologist or a doctor and get the right treatment for it. Otherwise, you may have a problem later. All right. And then problems with the reproductive tract, as I said, the womb itself, fibroids and other things can cause it. So these are the causes. So you can see that the causes in the woman is a lot more compared. Men is only things got to do with the sperm. The woman is a lot of things. So now, so this is a typical uterus with fibroids. So you see this fibroid, how is the woman easily going to get pregnant? Some of them are attached to the tube, they block the tube all over. And then, so we have to obviously sometimes do a surgery where we remove all the fibroids for you. So this is just an example. Okay, let me leave this one. Later we'll talk about fibroids. I don't want to talk about this. Now, so what are some of the things that will make you know as a female that you may have problem with fertility and as a man? So for the female, most of the time you may not have any symptoms. Just the fact that you're not getting pregnant after so many years of trying to get pregnant is what brings you to the hospital, all right? But sometimes there are certain signs that should give you an idea so that you get a checkup. Sometimes abnormal bleeding, irregular menses. You know, the fact that your menses are irregular mostly means that you are not ovulating. The surest sign that a woman is ovulating is that her menses is very regular. It always comes when she expects it to come. It doesn't change. But if your menses come this month, it comes on 10th. Next month, it comes on 20th. Another month, it comes on 4th. 2 months, your menses are not coming. It's not coming. 3 months, it's not coming. Then it comes. You know, very irregular. It only means that you are not ovulating. And that is why you're not having your menses, all right? Sometimes you're not having your menses at all. 6 months, 3 months, you're not having your menses. It means you have a problem. You are not ovulating, okay? And sometimes in between periods, then you are bleeding. All right, you've had your menses already. It's not time for your next menses, and then you see that you are bleeding. All right, these are all signs. Sometimes you feel a mass on your abdomen. All right, so having a mass there. Milky discharge from the breast. Women, always squeeze your breast sometimes. All right, and see if you have fluid coming from your nipple. All right, the only time you should have fluid coming from your nipple is if you are breastfeeding a baby. All right, if you are breastfeeding a baby. But if you are breastfeeding a man, an adult man, and he's feeling that something is coming into his mouth, he has to tell you, or sometimes ask your partner, when you start, did you feel any fluid in it? All right. Otherwise, you yourself press it sometimes because it means you have a hormone called high prolactin, and the prolactin will prevent you from ovulating. All right. That hormone is what makes a breastfeeding mother not get pregnant. All right, so if you're not breastfeeding and you're having that hormone, you're not going to get pregnant. And sometimes if you're a woman, you say you have a lot of hair. You have hairs on your chin, all right? You have hair on your chest, your abdomen too. You have a lot of hair, all right? It's all a sign of what we call hormonal imbalance or polycystic ovarian syndrome. You have to get checked up. All right, sometimes heat or cold intolerance, all right, it points to maybe thyroid disease, which also affects. And of course, inadequate sex. At the end of the day, if you are not having sex, you are not going to get pregnant. And that's a problem for a lot of people. They are just not having enough sex, but they want to get pregnant. For the male partner, they also may not have any symptoms, but of course, they have sexual dysfunction, or they have had a mumps infection in the past. Okay, it's also a sign. So how do we manage these people if you come to the hospital? All right, it's very important that you come to the hospital as a couple. Very, very important. Don't let the woman go alone. I've said it enough. You have seen that the man also has as much problems, and I've showed you tests to show that sperm count can be very low in men as well as, okay? So for the man, as I said, we don't do a lot of investigation, mainly semen analysis. In fact, most of the time, just semen analysis. How do we get the sperm? Go and masturbate and bring us the sperm. Or sometimes if you are there with your partner, you can do what is called coitus interruptus. We get the sperm and then we do the analysis. But for the female, we have to examine her pelvis. All right, the gynecologist will examine your pelvis. Your pelvis means your lower abdomen, to make sure there's no mass there like a fibroid and all those. There's no pain. Sometimes you have a lot of pain, which the doctor may think you have something like PID or endometriosis. These are certain things that can cause infertility. All right. Of course, you do a scan for you also to check if there's no fibroid or any problem in the pelvis. And you check your hormones. All right. The hormones make us know if you ovulate. At a certain time of the month, we expect your hormones to be at a certain level. All right. If it's there, then we know we are ovulating. Certain hormones. Sometimes your woman comes, like I've seen a woman, she's 38, but she wants to get pregnant. We check the hormones and everything shows that this woman is almost approaching menopause. All right, so the hormones are very important. And of course, we'll do a test to check if your tube is not blocked. I showed you the tube is very important for the sperm to pass through and meet the egg. And then we have to do a test to check if your tube is not blocked. So look at the woman goes through a lot more tests to be done than the man. So the man is very important to come with the woman. Now, of course, how do we treat the patient? So mostly the treatment is based on the cause, all right? What is causing the problem? All right, so we have to find the cause and so that we can treat it. That's why you have to see the doctor. Of course, but there are certain things that are very important. Lifestyle changes. If you smoke, you drink, you have to quit. If you use narcotic drugs and illicit drugs, the weed and all those, and they don't help at all. It has to be stopped immediately, all right? The kind of clothes that you wear, as I said, the man especially, let the testes float around freely. Very, very important. Have more sex. Weight management and diet is extremely important, all right, for both the man and woman. That's for the woman, so far as you're overweight, you have a lot of hormonal imbalance, and it makes sex it makes ovulating impossible, all right? So you have to lose the weight. And you see, when you are also obese and you get pregnant, you are at risk of certain diseases like something we call hypertension in pregnancy, where when you're pregnant, your BP goes very high, and sometimes they have to terminate the pregnancy to save your life, all right? And diabetes in pregnancy to the same thing. Your blood sugar is very bad. They have to terminate the pregnancy to save your life, just because you were already overweight before you even got pregnant, all right? So after struggling to get pregnant, and then the pregnancy has to be terminated, it's not worth it. So weight loss is very, very important, all right? And you have to lose weight by all means. And counseling on fertility awareness period. So, all right, I've talked about this. Of course, the man to accept varicocele, if you have varicocele, will have a surgery to remove those blood vessels. That's why it's very important that the man also comes to the hospital so that the doctor can look at his testis to make sure that there's nothing wrong with it. This picture shows varicocele. You see, this is the testis, all right, and there are a lot of blood vessels in. So when the doctor holds it, it feels like what we call a bag of worms, all right? Like you're holding a bag with so much worms in it, all right? It has to be treated by the urologist. All right, now we have what we call ICSI. ICSI is intracytoplasmic sperm injection. That is what is done for men who have low sperm count, because your sperms are very low, all right? And there are other ways too you can, but normally your sperm count is low and you still want to get pregnant. Those sperms cannot swim to get to the eggs, all right? So we have to take those small little sperms and then directly inject the sperm. So this is the video, they've taken the sperm, just one, because now you can't do it. It can't happen naturally again, as it should happen, all right? And then they inject it, they take the woman's eggs as well and inject the sperm directly into the egg. So the thing that happens naturally, now we have to do it artificial. So this is one of the things we do in what we call ART, artificial reproductive technology, all right? So this is just an example of what we call ICSI. All right, so the female too, I've talked about all this too. We have to do a pelvic examination, we have to do a scan, we have to check the hormones, we have to check the tubes, we do something we call HSG, that's hysterosalpingogram, where we check if the tubes are not blocked, all right? Sometimes we do a laparoscopy, all right? And instead of the HSG, we do a laparoscopy where it's like a keyhole surgery and we look inside directly, all right? If the woman, if you have fibroid, of course, or ovarian cysts, you have to have operation to remove them. If you have endometriosis, you have to remove them. All those things, you have to remove them before the pregnancy can happen. Of course, lifestyle changes, weight management, please. That is, you see, because a lot of the time, women, Ghanaian women in general, feel gaining weight, sign of prosperity, they are healthy, but medically, obesity is never, never good. And so weight management is very important, all right? And there are times that we, of course, when we check and your hormone level are not good, we correct it, all right? There are things we do to correct it, in things like when your prolactin is high, so you're having milk in your breast, or you have polycystic ovarian disease, we correct it. We sometimes give medication for ovulation, all right? Because most of the time, when you have problems with your hormones, your menses is not coming and all that, it means you're not ovulation. So we have medicine that we give to stimulate ovulation. And then we have what we call the IVF as well. Now the IVF is the biggest answer to infertility that the world has gotten. Before IVF started in 1978, if a man has low sperm count or a woman has her tubes blocked or she's old, almost at menopause, or she has a problem with her, nothing can be done. You are finished. You can't have a child. The only way is adoption. But now with IVF, this is possible. All right. So infertility has a treatment, and you can see that it answers one of the myths. All these myths, the myths, I said, all these are treatment. So with the IVF, normally we stimulate the woman, we give her some injections for her to produce more eggs. And then it gets to a point in the month, we go and harvest the eggs. All right. We take it out of her body, the eggs. The man gives us his sperm, and then we fertilize it to get in the lab. We put them together for them to get fertilized. So what will happen in the tube? Now the tube is blocked, so it can't happen. So we have to do that thing in the lab. And after 3 to 5 days, when it's become an embryo, we put it back into the woman's womb for her to carry the pregnancy. All right. So that is what we call IVF. And it's the biggest answer to fertility. So please, there is always a treatment for infertility. And IVF is something we do routinely. We do it a lot, and we have very good success. All right. So this is just a picture of IVF being done. And now we have surrogacy, to which is other options. All right. Now surrogacy, when we take the woman's, there are two types. Okay, you know that sometimes the woman has gotten to menopause, or she's not gotten to menopause. She's close to menopause. She's not even producing eggs at all. All right, she's late, and it's happening to a lot of women. With these days, women, career women, women are not getting married early. Women are so busy. As I said, from 35, your fertility declines. All right, and so for some reasons, maybe a woman is not producing eggs anymore. All right, so we can get a donor egg. Somebody donates egg, and then we can fertilize it with a partner's sperm. All right, and put it back into a womb. That's what we call gestational surrogacy. There are some too what we call traditional surrogacy, where some women have a problem with their womb, or they have a disease that they can't carry a pregnancy because of the disease. They can't carry a pregnancy. Other women feel they are so rich. Last week I had a lady, very rich woman. She said, "Look, doc, I don't want to carry a pregnancy. Can you get a woman to carry the pregnancy for me?" Of course, that is also done. That's what we call surrogacy. So the woman carries the pregnancy, but that woman has no genetic relation to the pregnancy she's carrying at all. Absolutely nothing. Of course, there's adoption as well. Okay. Now, as I said, and I showed you some of the sperm count, there's something which everybody here should know about, which is called oxidative stress. All right, oxidative stress, and as you can see, it plays a well-established role and as a cause of unexplained or sometimes explained infertility. All right, so everybody has certain things in their body which we call antioxidants, and I'm sure if most of you are listening to things as well, you are well read, you hear about antioxidants a lot. A lot of doctors talk about antioxidants, all right, because your body produces a lot of what we call free radicals, all right, which destroys our bodies, our DNA, our cells, and they have a lot of effect on the ovaries, all right. Those, we call them oxygen reactive species, all right, and they can damage the DNA of the sperm and the egg. Of course, the mitochondria as well. These are very, very vital for fertility to happen. All right, and that is the reason why male sperm count has been reducing over the decades. All right, all due to oxidative stress. Now, the answer to the oxidative stress is antioxidants. All right, because the antioxidants protect the body and these cells from the problem caused by the free radicals. Now, when your body has so much free radicals, that is what we call oxidative stress. And so far as you are breathing, you are eating, you are producing energy, your body will produce free radicals. So antioxidants are there in your body to help clear the free radicals and prevent oxidative stress. All right. Excess free radicals or oxidative stress in the what we call follicular fluid, that's the fluid around the egg, it damages the egg. The DNA of the egg can also be damaged, leading to inability to fertilize. Even when fertilization has been achieved, oxidative stress can prevent it from developing properly, from implanting, and prevent the embryo from developing and causes damage as well. And when it comes to male, research on male infertility demonstrates that the sperms are also very vulnerable to the damage caused by oxidative stress, which can result in the motility. So the sperms will not be moving fast, or they are not well viable, or they don't look good. Their morphology, I told you, their morphology is not good. They may have big heads, two tails, and all those things. All right. So studies have reported that levels of antioxidants in the plasma of infertile men were very, very low. All right. So most tests that have been done on infertile men show that the antioxidant level was low. So their body is not able to fight oxidative stress. And so you can see from this graph that a lot of things here that causes infertility in men: smoking, alcohol, obesity, stress, okay, advanced paternal, a poor diet, all right, heat, pollution, all these things, pesticides, and you know our world is all polluted. All these things lead to a lot of oxidative stress. And then when you have low antioxidants, it damages the DNA of the sperm, all right? So that's how important oxidative stress is, all right? And these are very detailed. These are all some of the things that causes oxidative stress, all right? Drugs, smoking, pollution, cancer, prolonged stasis of the epididymis. So all these things cause oxidative stress, and it damages protein, lipid. These are very detailed, DNA damaging. So these are studies that have been found. Now, can glutathione increase fertility? Now, glutathione is an antioxidant, all right? And as I said, antioxidant is what prevents or fight oxidative stress. And these are studies that have been done. A lot of studies have shown that increasing the body levels of glutathione can improve sperm, egg, and embryo quality. In fact, normally when we are doing IVF, the success rate of IVF depends on the quality of embryo. And in polycystic ovarian syndrome, which I've studied, that's normally the problem with women when they don't ovulate, they don't have their menses is irregular. It has been shown that in polycystic ovarian syndrome, oxidative stress has been shown to be involved in mediating the whole process, all right? So that's how important oxidative stress is when it comes to infertility. Now, you may not see this clearly, but this was a study that was done where this is what we call a crossover study. They were checking the parameters of sperms, okay, in a lot of men. And the first one, look at my cursor, this is motility, velocity, abnormality. Now, what the crossover study means is that the dark lines is people who were actually given the medication, which in this case is glutathione. And the dotted lines are people who were given placebo. Now, in the study, when they say placebo, that means they are giving they are not giving you anything. They are giving you something, you feel it is a drug, but it can be coconte, or it can be sugar, it can be anything, but it's not the thing that you need. So you can see that for those, the thick lines, they were being given a glutathione, which is an antioxidant. The motility of their sperms was increasing sharply. And then at 60 days, it's a crossover study. So what they do is that in a crossover study, they change it and they start giving them placebo. And then those who were being given placebo already, they start giving them the active drug. So you see, at the beginning, those who were getting the glutathione, the motility of their sperms were increasing. And then at 60 days, they started giving them something else, and the motility decreased sharply. And those who were being given the placebo, there was nothing happening to their motility. It was still bad. But 60 days, when they crossed over, they gave them the active ingredient, which is the glutathione. You can see that the motility increased. The same thing with velocity. All right? When they were giving them glutathione, their velocity increased. Those placebo, nothing happened. And then at 60 days, they started giving them glutathione, their velocity also increased, and this one, their velocity dropped. The same thing with abnormal forms. The abnormal forms declined when they were being given glutathione, all right? And then when they stopped, the abnormal form increased. And you can see the placebo, the abnormal form stayed the same, but when they were given a glutathione at 60 days, it declined. So this shows the effectiveness of antioxidants, in this case, glutathione, in improving the parameters of the sperms in infertile men, of course, and it helps with women as well. And this is my glutathione that I recommend for people most cellgevity. This is a potent antioxidant from the US. As gynecologists, we prescribe so many other antioxidants. From when I was in medical school, I saw my bosses prescribe so many antioxidants. Most of them were from India, all right? Indian, they have so many. I'm sure most of you have seen some before. But this is from US. It's gone through a lot of tests. Even in Ghana, University of Ghana School of Pharmacy has done tests on it. It's been shown to be effective, and I've had a lot of personal experience with it, all right? And of course, it contains this, what we call ribose, which increases your glutathione level, all right, which is what we need. But it also has all these other antioxidants, which are very good, all right? Vitamin C, resveratrol, cordyceps. Cordyceps is very good in helping improve men's sexual performance and stamina. So a lot of men I give it to, they who have problem even with sex and erection, they are very, very grateful because of the added benefit of cordyceps in increasing men's sexual performance and stamina. All right, so please, this is a very good product when it comes to antioxidants, glutathione. The study that I showed you, the active ingredient in this, which is glutathione, was done using glutathione. All right, so that is it for both men and women who having problem with infertility. Please get this product. All right, whoever invited you to join this call can definitely get it for you. Contact the person that you want this and be taking it. It will help for both men and women. And for the weight loss, I talk about weight loss a lot. You saw it for both men and women. Now, a lot of people, I tell them, go and lose weight, go and exercise. Nobody here can say, be honest with yourself, you will never go to the gym. You are never going to go. You go for 3 weeks and you stop. My doctor, my knees hurting me and everything. Now, I love this product because this product helps your body to lose weight by increasing your metabolism, all right? Just like you've seen a lot of people who can eat a lot, but they don't gain weight. This product increases your metabolism because those who have a high metabolic rate, so it increases your metabolism to also a higher one. So your body begins to burn fat, all right? And that is how you lose weight, all right? So you don't have any diet restrictions and everything. Just use them. For most of them, I tell people, use them continuously for 3 months for best result, all right? So please, if you are overweight, you've seen it so much, it's not good for a woman if you're having problem with fertility or you want to get pregnant later in life. Don't wait till you get married and now you realize that you have a problem and you're trying to lose it. So whoever invited you to join this call, ask them how you can get this product. The person would help you get this product. So conclusion, infertility is a major health challenge with implication for the couple's psychological well-being, all right? There are various factors. It is important to seek help early. Don't wait till it's the time is not good because of infertility, and there is always a solution. You can get pregnant. Definitely, you can get pregnant. No blame game. All right. There's a solution to every problem. Okay. So you can say I answered most of these myths. Infertility is almost always caused by the female. Remember, 30-30. Answered all the myths. Infertility is a spiritual problem. No, it is not. It is due to lack of knowledge. And I'm happy everybody here has gained enough knowledge to share with the wider population. And if couples will relax, they would conceive right away. No need seeking help. Please seek help. Don't wait and grow older because you don't have time. Infertility is a cardinal. The sperms coming out means it's abnormal. No, women, please. Women always ask me this question, doctor. I slept with my wife. When my husband sleeps with me, the sperm comes out. It's not the sperm which is coming out. What is coming out is the semen. That is the fluid in which the sperm swim. Those fluid produced by the prostate gland and the seminal vesicle. That is just fluid. You see, fluid can't suspend. You get it? How can you stand up and you expect fluid to hang? The fluid will definitely come out. The sperms have swum, all right? So the fluid coming out is nothing. It's not the sperm which is coming out. So what you see with your eyes is not the sperm. Later can be done to improve a man's sperm count. No, I've showed you that a man's sperm count can be done, increase. Antioxidants are great. If you have a structural problem like varicocele or obstruction, you have to see a urologist to operate on you, all right? Otherwise, antioxidants are great as for you to take. A man's fertility does not change with age. No, it changes, actually. People think a man that nothing happens to a man. DNA damages the small sperm as a man is growing. One of the sperm count I showed you, that was 1.2 million. That was a man who is 60 years. He had 2 children when he was younger, but he's lost all the children. He's gotten a wife now. He wants to give birth again. And the fact that he has 2 children before made him feel it was okay. But look, the sperm count was very low with a lot of morphological damage, DNA damages. And most of these DNA damages is due to what? Oxidative stress, as I've told you. So antioxidants are very good for people to take, like the cellgevity I showed you. Infertility means you can't have a child. That is false. IVF is there. Treatment for all the causes are there. Just contact a gynecologist. You can have a child. Smoking marijuana affects fertility. Eating habit and weight have no bearing. That's false. I've said it already. Lose weight by all means. Eat well. Family planning does not cause infertility. All right, it doesn't. All right. So thank you all. And that's my contact if you ever want to contact me. And as I said, if you need any of those products, to just contact whoever invited you to join this call and get the product as well. And by all means, if you have a problem with infertility, see a gynecologist. There is hope for everybody to have a child. The world is so modern now. Men are going to space. Definitely, you can also get pregnant. All right. So I'll now open up for questions, and feel free to type in your questions, and I'll see which of them I can answer as well.
Thank you very much, Dr. Parker. Thank you very much. We appreciate this. It has been an elaborate, very extensive presentation. So yes, at this point, please put your questions in a chat box. He'll be reading and he'll be answering them as quickly. But there were some few questions earlier on. Somebody said, does masturbation cause infertility? That's the first question. Does masturbation cause infertility?
No, masturbation doesn't cause infertility.
Okay. Please put your questions in the chat, but we have a few minutes more. What is varicocele? Somebody asked. Or another person wants to know what is endometriosis.
So varicocele is basically when you have blood vessels in a lot of dilated blood vessels in your testes, all right? And it brings heat to the testes, and so it affects spermatogenesis, that's production of sperms, all right? And it doesn't help at all. When you have varicocele, you would have to see a urologist, and you would have to have an operation to sort that out. Endometriosis is one of the pelvic pathologies where you have endometrial tissue. That means tissue that is supposed to be inside the womb. It's at places where it's not supposed to be, sometimes attached to the ovary, to the tube, to the wall of the uterus. The woman normally have a severe pain during her menses, very, very severe pain. It's not a joke, all right? And sometimes during sex too, she also has a lot of pain during sex, and it can lead to the tubal blockage as well. So that's what we call endometriosis.
Somebody sent me a private message. They want to see the first product that you were recommending, the cellgevity. They want to see it so they can take a screenshot. Another question is, I gave birth 5 months and still have not seen my menses. Should I be worried?
5 months? Oh no, 5 months, and if you are surprised you are breastfeeding, you may not have your menses now, okay, because you are still breastfeeding. And when you stop breastfeeding, it should come. But if it's not coming after stopping breastfeeding, then you may have to contact a doctor.
Yes, the recording will be made available on the YouTube channel. I'll provide that shortly before we leave. Thank you very much for asking. Can you still menstruate whilst your tubes are blocked?
Oh yeah, you can menstruate. Your tubes have got nothing to do with your menses. Your tubes and your menses have absolutely no relationship. Your tubes and your menses have no relationship. Your tubes only block the passage of sperm to meeting the egg. So you will menstruate, definitely.
Please, can endometriosis be cured for the person to conceive naturally?
Yeah, it can be cured. We can manage it, but most of the time it depends on how extensive it is. All right. Sometimes when it's very extensive, you may have to go through IVF. All right. If it's not so extensive, you can get pregnant naturally. It depends on how extensive it is.
All right, thank you. When you have ectopic, does it affect fertility?
Yeah, you see, the thing about ectopic is that when you have ectopic, it means that tube was blocked. So the baby was growing in a tube. You know, the blockage might have been so small that the sperm was able to pass through and meet the egg. But when they fertilize and they become an embryo, it is too big, so it can't return. It grows in the tube and it ruptures. So as surgery, we cut that tube off. Now the thing is that whatever blocked that tube is likely to have also blocked the other tube. All right, but it's not 100%. So all we advise is that as soon as you miss your period, make sure you do a scan to make sure it's not another ectopic. But of course, if after ectopic you're not getting pregnant for long, know that the other tube is definitely blocked, and so that you seek help immediately.
Doctor, what does it mean by a woman feeling a mass?
Yeah, so if you are feeling a mass in your abdomen, in this instance, it could be a fibroid or it could be an ovarian cyst. All right. And so if you are having an issue with infertility and you have a mass there, like a fibro-ovarian cyst, definitely that has to be dealt with.
Is hypothyroidism and PCOS the same?
No. They are very different. Hypothyroidism is affecting the thyroid gland. PCOS is mainly something that is affecting the ovaries.
All right. After fibroid surgery, can one give birth?
Definitely one can give birth after fibroid surgery, but normally we advise women after fibroid surgery, try and give birth within a year. Don't wait too long. From 6 months, seriously try to give birth. We want you to get pregnant within a year after fibroid surgery because of the risk of adhesions and all that later on.
Can a woman menstruate regularly yet does not ovulate?
Yeah, I mean, normally regular menses is a sign of ovulation. That is it. So far as you are menstruating regularly, it's a sign of ovulation. But in medicine, we never say 100%. So if you are still not getting pregnant, we may have to still check your hormones to be 100% sure.
What should be the interval for marital sex?
I don't get the question, but have sex as much anytime you want to have sex. But if you are trying to get pregnant, at least it should be 3 times, not less than 3 times a week. But as a marital, if you want to do it 10 times in a day, it's up to you. So far as you have the energy.
What is the cause of blighted ovum?
Okay, normally that is due to, I talked about DNA damage. Those are more of genetics. I talk about DNA damage when I was talking about the damage that oxidative stress causes. So blighted ovum it's not a normal pregnancy. In layman terms, it's an abnormal pregnancy. You see a gestational sac, but there's no fetus in it. There's nothing in it. It's just that's what we call the layman language blighted ovum, and mostly due to genetics and DNA problems, chromosomal anomalies, those things that causes that.
All right, somebody says, I lost my pregnancy a year ago. Very sorry for that. And they did DNC for me, but I'm no more getting pregnant. What could be the issue?
Well, so it could be so many things. Obviously, you have to be, a lot of tests have to be checked. How was the DNC done? Was it in a hospital? Was it covered with antibiotics? Are you still having your menses after the DNC? So all these things have to be found out first to know if there was a problem or there was a complication from the DNC.
Does processed spices for cooking cause infertility?
Not that I'm aware of.
What should be the normal BMI of both men and women?
So the normal BMI should be at least between 20 and 24.5. You see, if your BMI is above 25 to 29, you are overweight. Above 30, you are obese. Above 35, you are morbidly obese. So we have those steps. So at least for a healthy person, your BMI should be between 20 and 24.5.
Doctor, can the color of your menses affect fertility?
Now, with menses, we are not interested in the color and the number of days. What we are interested in, how regular, is it regular? Sometimes women say, oh, doc, my menses was 5 days, now it's 3 days. We are not interested in that. The average woman the volume of menses that is normal is 80 mils. Averagely, 80 mils is about 4 tablespoons. So we're not interested in how heavy the bleeding is, the number of days, the color. Is it coming regularly? That is the most important thing.
Please, if one's breast is sucked often, does it cause the prolactin to increase?
No, it doesn't. Please, it doesn't. When you're pregnant and you're breastfeeding, that is different, all right? Your body has been prepared throughout the pregnancy for the prolactin already. So please don't prevent your husband from sucking your breast.
Someone is complaining that some doctors will advise you to start giving birth or having sex. Why do they say that?
Well, I don't know what he means, but generally, maybe people don't want you to grow old, especially if a woman is growing, she's hitting her mid-30s, definitely, because your fertility will begin to decline, and people will start advising you to start thinking about having a child. Otherwise, you may end up trying to seek IVF later. I see a lot of people asking the cost of IVF. It differs from hospital to hospital. You can contact me. My number is there if you think you need IVF, and I'll show you how much different places take.
Is there any relationship between sugar intake and fertility?
No, please. There's no. But of course, what's your diet? I mean, everything. You don't have to take too much sugar. Sugar is so much calories. You gain weight, at risk of diabetes and all that. So generally, as I said, in a lot of this thing, your diet is very, very important. You can see that slide. Your diet is very important. So generally, watch your diet,
Can a menopause lady give birth?
Not, yes, IVF and surrogacy. As I said, in IVF, we have something we call donor eggs. All right. Obviously, the child is not going to be the lady's biological or genetic child. All right. That child is not going to be your own child. You get somebody's egg, and we have a lot of people who do donation. They donate their eggs. A lot of people do donation. So we get a donor for you to donate eggs for you. And then we can use your husband's sperms for it. And then when we fertilize, we put it back into your womb for you to carry the baby. Or we can put it in a surrogate mother's womb. All right. Of course, we have donor sperms too. So there are some sperm who produce absolutely no sperm. Okay, absolutely nothing. It's not like the ones that they are low. So those ones too, we have donor sperm IVF.
Doc, please, does changing date of your menses a sign of infertility? Maybe you have 30 days to 35 cycle days.
Yeah, it depends on the variation. Of course, always there'll be a plus or minus 2 to 3 days in your menses, even for a regular person. The fact that you had the 29th of August doesn't mean to definitely come on 29th September. You get it? There may be plus or minus 2, 3 days. But when the change is big, 1 week, 2 weeks, 3 weeks, sometimes it's not coming at all, definitely, then that is a problem.
Can taking emergency contraceptive pills lead to infertility? Frequency?
Okay, now emergency contraception, listen to the word, emergency. It is for emergency. Now, what gynecology, family planning experts don't like is people are beginning to use emergency contraceptive pills as their regular form of contraceptive. So tomorrow you go and do something, or then you pop in some emergency contraceptive. Next week you go and do something, you go and pop it in. We always say that if you have to take emergency contraceptive pills more than twice in the year, it means you need a regular form of contraceptive. All right, because it's only for emergency, rape, incest, the condom burst. And then go and take. Now, 1 pill of the emergency contraceptive pill is equal to taking 1 whole box or 21 pills of secure. That is a high dose. It's like, so you put 1 pill of emergency contraceptive in your mouth. It's like you're going to take secure. You're taking 21 pills and swallowed it at once. That is what you are doing. So you can imagine if you are doing it. And a lot of women who take emergency contraceptive, they realize that their cycle becomes very irregular. Now their menses is not coming, or they can't even time it anymore. It just messes up their hormones. So please, it is for emergency.
What causes PCOS?
I didn't hear your question.
What causes polycystic ovarian syndrome?
Oh yeah, so generally it's got to do with hormonal imbalance. All right, your FSH, luteinizing hormone, insulin too has to play a factor in it. Obesity plays a factor in it. All right, so it's a whole complex kind of something that I can't go so much in it. But generally, the people with it do not ovulate. They go for months without having their menses, and so of course they will have problem with fertility unless they are treated.
All right, those asking about the cyst, fibroid, and the rest, Dr. Parker will come again to share with us more on that. So that will be another time for more details. Someone wants to know, I'm 40 years and I've been trying to get pregnant for the past 3 years. I've done everything, IUI, but no luck. Is IVF my only chance?
She said she's how old?
40 years. And she and her husband has
Oh,
never
yeah, it's very important she tries IVF. Age is not on her side, and that's the problem. Sometimes people try all something, they go all around, and sometimes because of the cost of IVF, they keep running away from it, and so they don't do it, and then it gets too late when their ovarian function, ovarian reserve is gone so down, and it becomes difficult. So IVF is your option right now. That is what our advice is. You don't delay with that, you know. My number is there. You can contact me on that.
Okay, thank you. Can you get pregnant whilst menstruating?
No, you can't get pregnant. You see, a lot of the time women say, oh, I was pregnant and I was menstruating, I was seeing blood. What you are having is what we call threatened abortion or threatened miscarriage, all right? It is a kind of miscarriage that you are having. Threatened. It doesn't mean you definitely have miscarriage. The bleeding will stop and the pregnancy will continue. So what you are doing, having no menstruation, is what we call threatened. So if you are pregnant and see blood, please report to a doctor and be managed.
Can some allergies lead to low sperm count?
Well, not that I am aware of any allergies that can lead to low sperm count. You see, the testis is a sacred place. It is protected. We will have what we call blood testis barrier. Things don't easily go into the testis. It is really, really well protected. So it is hardly any allergies affect your spermatogenesis.
Can a man impregnate a woman where he has premature ejaculation?
Oh yeah, definitely. There's no reason. Premature ejaculation means the sperm comes early. The man has ejaculated. All right. So far as in that 1 minute, 30 seconds, all the man needs is even 10 seconds, put the penis in the vagina, ejaculate in the vagina. That's all.
After an ectopic surgery, how long should you wait to get pregnant?
Or normally after an ectopic surgery, you must have your okay to start having sex. You can get pregnant. Ectopic surgery, unless it's where it was kind of where the was, so that the uterus is cut into. Then, of course, the doctor will tell you to wait longer. So after the doctor who does the surgery will be the best to advise you. But a normal ectopic surgery where it's just in the tube, and you can get pregnant anytime.
When the fibroid is very small, are there remedies or is it only surgery?
You know, fibroid, it depends on if it's giving problems. Okay, if it's giving you problems, then you may have to depend on the problems and where it is located. A fibroid can be small, but in the inside the womb itself, like we call endometrium, you have very, very heavy menses. All right, but a fibroid can be big, but it will be on top of the womb and you don't have any problem. All right, but most fibroids, when you have it, you just have to do scan from time to time to see how it's advancing.
For a woman who has normal menstruation and a man who has normal sperm count, but are still not able to conceive, Doc, what could be the cause of their infertility?
So as I said, when I went through all the causes, I said some of them is unexplained, about 10%. We just can't find the cause. The man is fine, the woman is also totally fine. We just can't find the cause. All right. So in such cases, we always will recommend an IVF at the end of the day for the couple.
Doc, what's the age for menopause and how many days should one menstruate normally?
So the age for menopause varies in different women. There's no specific, but the average age is in this part of the world, in Ghana, is about 52 years. Most women, that's the average that have gotten to menopause. Menses, anything between 2 to 7 days, it's okay, 2 to 7 days.
How many times can someone do surgery for an ovarian cyst? Because she's saying she's done it and it has come again.
Oh yeah, you can do it again. Certain things like cyst and fibroids tends to recur. Ovarian cyst normally, if we would measure it, if it's above a cut of like 5 centimeters, we would always advise you to do surgery because it can rupture, it can twist, and gives you problems. So at that point, we would encourage you to do surgery. And these are some of the ladies too who we encourage to start their family early so that they don't have any issues.
If a woman misses her period and feels the early pregnancy symptom for some time, and after a few days she doesn't feel them again, even though she has pregnancy test positive, what does it mean?
Oh, so she needs to do a scan. Okay, so some of the commonest cause of this is what we call missed abortion. All right, so the woman is feeling the pregnancy symptoms, the hormones are there, the main pregnancy hormone, which we call HCG, so that's what gives all the symptoms. And then at a point she stops feeling the symptoms. And we do a scan and we see that the baby's heartbeat is no longer there, means the baby is dead virtually. And so the pregnancy is intact there, but the baby is dead. All right, and we call it a missed abortion. And that's a classic way the women report with such thing. Vomiting, all the breast and gut, and all of a sudden they are not feeling them again. And so that's missed abortion.
Doc, can there be fertilization without implantation?
Yeah, I mean, sometimes implantation cannot happen. I showed you when I talk about the problems this oxidative stress gives. Sometimes there's problem with implantation. And so sometimes implantation doesn't happen and you have a miscarriage. A lot of women even have miscarriage without knowing that they were pregnant. It happens to a lot of women.
Doc, after IVF trial twice, is there any other option?
You know, Michelle Obama, I think, or Celine Dion, one of them had IVF 3 times. You know, IVF is the last option. There's no option after IVF. You know, so even in the richest countries, the rich people, sometimes some do it more than once. And then they have, if you read the memoir of Michelle Obama, I think she did it 3 times or twice. I don't remember. And Celine Dion too. So there's no option after IVF, unfortunately. Hello? Hello, am I off or Dr. Albert is off? So if you can hear me, type Y. Okay, so I think we've lost Dr. Albert.
Yes, I can hear you now.
Okay.
Yes. All right. So somebody there, okay, I've asked about that one. A lot of people are asking about menstruation. Dr. Parker will come back again and talk to us about the cyst, about menstruation, about fibroids, so we can skip that one. Somebody is asking, azoospermia, what is the remedy? Azoospermia.
Yeah, so azoospermia, you're not producing sperms at all. Okay, so as I said, the remedy is sperm donation. All right. If you don't have money to start a sperm donation, you are thinking, and also we have to check if it is obstructive azoospermia. Sometimes there's an obstruction in the pathway of where the tube that the sperm passes through and comes out. Sometimes there may be what we call obstructive azoospermia. So that's why it's not coming. Sometimes there's what we call retrograde azoospermia. The sperms rather enter into the bladder and into the urine. All right, so if you have azoospermia, you first have to be assessed by a urologist to find out what really is causing. They will do some hormones for you. I had a patient like that. They had to do some hormones and realize that the hormones that are needed to help with the testes, she's not really producing it. And then to be treated. Of course, you can also start using the antioxidants as you are waiting, just in case. it could help you because I showed the effectiveness of antioxidant, but definitely see a urologist. The thing is that most gynecologists, as soon as patients come to see us for the management of infertility, we put them on antioxidant, both the man and the woman, as we also investigate to find out the cause of what is happening. So with azoospermia, these are the things you have to see a urologist to find out the cause of it as well. If there's no cause, nothing can be done. The final distance is you can get a sperm donor for you.
Is it possible to have more than 3 CS?
Yeah, it is possible to have more than 3 CS, but it is not advisable to, because the more CS you have, the more complicated it is, and the more risk you are at having complications, especially if you are not getting a specialist gynecologist to be doing the surgery for you. Okay, and even the specialist gynecologist, we don't want to be doing CS on a woman who has had multiple CS. It makes it very difficult, and the risk of complications are higher.
All right. Is taking Hygra more often, can it lead to infertility in a man?
It's taking what?
Hygra, Hygra, Hygra.
Oh, okay. I'm not sure about that.
Okay. What is the recommended diet to improve infertility?
Oh, okay. So eat good food, eat a balanced diet. A balanced diet is something we all do not eat. All right. So have a good balanced diet. Very, very important. The vitamins, your fruits and vegetables, and of course take food supplement. Food supplement are things I always recommend for both men and women, also who are trying to improve their fertility. And as I've told you, I've showed you this food supplement that boosts your glutathione level, which are good, all right, to protect the DNA of the sperms and help in spermatogenesis, and also to help protect the DNA of the eggs as well, and help get more quality embryos. So good food, supplements, and a healthy lifestyle. Yeah.
Can an individual who has undergone chemotherapy for ovarian CA still be fertile?
Well, we have to check the person's ovarian reserve, all right? We have to check the person's ovarian reserve. That's important. We have tests that we do, and it helps us to know how active the ovary is, how much eggs the ovary still has as well. So that's the best way to check for the fertility of the person.
All right, we'll talk more about ovulation and the rest when Dr. Parker comes back, a few weeks to come. How do you get surrogate mothers, please?
Oh, most of the IVF centers, we all have people who do those things. I mean, we all have people. So just contact any doctor who is into IVF. As I said, you can contact me as well. And we keep the mother, of course, surrogate mothers are kept in the hospital for 9 months. So that makes it, you have to have money because they are not allowed to go home in case they run away and in case they go and be taking things they are not supposed to take. So they are kept in the hospital for the whole 9 months. They are fed in the hospital. As soon as they deliver, the child is taken from them. They have absolutely no bond with the child.
Is it true that when you are doing IVF, you have to stay in the hospital for 9 months?
No, please, there's nothing like that, okay? You don't have to stay in the hospital. You're a normal pregnant woman, you go home, you come for your normal antenatal. There's nothing to do if you stay in the hospital for 9 months.
Coco Blay wants to know, what supplement will you recommend as a doctor? Coco Blay wants to know.
Yeah, so those are the 2 supplements I showed. This one, especially cellgevity. I showed you the studies. It improves your glutathione level, and glutathione helps increase the sperm motility and spermatogenesis, the viability, and everything. And for the woman, to protect the DNA, it improves the quality of her eggs, okay, and then the embryo, all right? And it has all these other antioxidants, which are very, very good for boosting fertility as well. And of course, if you are obese, you definitely have to try and get a switch and take and help lose weight. So contact whoever sent you the link for this call and tell the person if you want this product. The person will definitely help you to get the product.
What is the solution to retrograde ejaculation?
Yeah, so as I said, with those things, it's mainly the urologists who handle it. But of course, the sperms enter the urine, and so there's a way where the sperms can be taken out of the urine and washed and then used to fertilize the egg, either in IVF or IUI. All right.
Like I said, by popular request, Dr. Parker will be back again to share with us on cyst, fibroid, ovulation, menstruation, all of that. But someone keeps asking, somebody wants to know, is it normal to feel abdominal pain when ovulating?
Yes, yes. We have what we call mid-cycle pain, or it's also called metaswitch. All right, that's the name of the person who discovered it. Where, because the egg is released out of the capsule, okay? Released out of the capsule. So there's a pain, a sharp pain that the woman will feel. And of course, it's a regular pain that you feel every month in the middle of your cycle. So you get to know that sort of thing. Just a sign that you ovulated. Okay, that's also one of the questions we ask to know if a woman is ovulating. It's called mid-cycle pain or metaswitch.
Doc, can one show signs of pregnancy with a positive pregnancy test, yet ultrasound shows empty uterus for over 3 months?
Well, so far as the uterus is empty, we have to make sure it's not an ectopic pregnancy. If your pregnancy test is positive at 3 months and a scan is showing that there's nothing in the uterus, that means the pregnancy is somewhere else. And then it has to be, means it could be an ectopic pregnancy. Of course, there are rare things called cariocarcinoma and others, which will also produce a positive pregnancy test. But that would be going into too much details. But common things are common in medicine.
Thank you very much, Dr. Parker. Last 2 questions. What causes semen to change color?
Well, if there's blood in your semen, it obviously will change color. And that's the only thing that's the thing that could change. You may have some blood in the semen. Of course, if you have some very bad infection as well, it could also cause that.
Thank you very much, Dr. Parker, for spending time with us. As you rightly, this has been one of the best presentations so far, and we are grateful to Dr. Parker. Please feel free. Recordings, people keep asking, and I'm saying it again. Recording will be shared on the YouTube channel. I've posted a channel link in the chat box. Copy it. The recording will be there in a few minutes' time. You can always watch it and go back and watch every other one. That last week we talked about erection, erectile dysfunction, prostate issues, men's health. So I'm going to upload a recording there. You subscribe, put the notification on, share with as many people as possible. Feel free. Dr. Parker gladly, openly recommended a lot of supplements, cellgevity for antioxidants, and then metaswitch for your weight. Of course, so please get in touch with your friend who recommended you to join this link. And of course, once again, thank you very much, Dr. Parker. And by popular request, Dr. Parker will be back with us again to talk about ovulation, menstruation, cysts, fibroid, and all those questions that were coming up. Dr. Parker will be available to us again as an experienced senior gynecologist to share all that with us. As you all are aware, this is a weekly program that we have every Saturday, 4:30 p.m. Ghanaian time, 7:30 p.m. East African time, and 5:30 p.m. Nigerian time. Next week, we are going to be blessed with a plastic surgeon who is going to share with us on a very important and very controversial topic, liposuction. Yes, liposuction. So we're going to have especially a plastic surgeon who's going to grace us. He's going to share with us on that topic, liposuction. Feel free, the YouTube channel will be available. You can ask questions on the YouTube channel as well. You can ask questions on the YouTube channel, and Dr. Parker and myself will be available to answer all the questions that are asked on the channel. If you have any questions, you want to reach out to any of our specialists that are featured on any of these weekly calls, you can contact me. I'm Dr. Alberts. I'm the host. Feel free. Every other question that wasn't answered here, please, we appreciate your time joining us. So don't feel offended at all. Feel free, put your questions in the comment sections on YouTube. It's going to be there forever. So again, I'm sharing the YouTube link. Put your questions in the comment sections in the YouTube link, and we will gladly reply to you so that every other person learns. All right. Thank you very much for joining us. And a special thank you to my senior colleague, Dr. Parker, I must say this was like somebody described it, a PhD presentation, very detailed. You realize this is a sophisticated topic. And the take-home message, summary, is that infertility is not caused by just women factors or female factors. Both men and women contribute equally. And it's easiest to investigate the man first. It's very easy, but the easiest to do is to investigate the man first. I know a lot of men, because of ego and a lot of other issues, they will complain. And don't be deceived. The fact that the man has been told to be a father to previous children doesn't mean he was fertile. Those children may not be his. So you need to be sure. That is why you need to see a doctor to guide you. And Dr. Parker made it clear that oxidative stress is a key contributing factor to most of the causes of infertility. He shared with you the data, evidence to that effect. All right, so both male and female contribute equally. Oxidative stress contributes greatly to most of the causes of infertility. The men, our testes have to be hanging. Dr. Parker said we should allow it to swing because it has to be outside. It's a sacred factory, Dr. Parker rightly said. So those are the take-home message. Those who are asking about menstruation, ovulation, cyst, fibroid, Dr. Parker will be coming back again. Again, I'm sharing the YouTube link. Go there, subscribe, put a notification on, and watch the recording of this one and the previous ones that we've done already. If you want to contact me personally for any questions, anything related to medicine, anything, my contact is on the line. We are once again grateful to Dr. Parker. Put your questions in the comment section on your YouTube link, on the YouTube channel, and we will respond to you. That is assured, you will respond to you. We are offering this free just to help give back. There is a lot of misinformation, a lot of lack of adequate education out there. What should I take? What is recommended? There are good ones. Our senior specialist has recommended them. They are very expensive and very, very extremely effective. That is assured. He has had a lot of experiences with it. I equally have had a lot of experiences with the product that he's recommended. We are glad to have you join us. Once again, until next week, it's been a pleasing pleasure serving you all. Enjoy the rest of the day.